Welcome and thanks for joining us. My guest today is Kevin Moss, the editor of Consumers Checkbook Guide to Health Plans for Federal Employees. Kevin, it's good to have you with us.
Thanks, Tom.
Especially on this first day of open season under a very strange year, I guess we're going through. And by the way, there's only a week until the potential for an interruption in appropriations for federal agencies. And so there might be furloughs. That will not affect open season or health care coverage, correct?
Nope. That'll all happen as it normally does. Make sure you go through your agency, follow your agency's instructions in terms of signing up for your health plan. And worst case scenario, even if there is an interruption, you would just keep your same health plan next year. That's how FEHB works.
Right, so nobody goes uncovered in health care just because of what Congress does or does not do for the federal budget.
You're going to have your federal health insurance.
Okay, good. Well, let's get that out of the way. And if you will have federal health insurance in 2024, it's probably going to cost you a little more. Give us the overview and some of the details on premiums.
Yeah, so premiums are going up. Not quite as high as last year. So last year premiums went up 8.7%. This year, 7.7%. So a little bit less, but still pretty high overall. And if we think about last year's 8.7, this year's 7.7, this 2-year period is really one of the highest 2-year periods of premium increases federal employees and annuitants have seen in recent times. We only have to go back 2 years where the average premium increase was, about 3.8%. So we never know, what's going to happen in the future in terms of premiums, but they tend to be looking up. When OPM was talking about these premium increases, they were referencing higher prescription drug usage, higher outpatient care as reasons why these premiums went up. And then we can also look at what's happening in private industry, and we see employer-sponsored insurance in the private industry going up about 7%. Mm-hmm. So this is happening really across the country, and OPM and the FEHB program is not unique here. These are for sure expenses, and so it's important. It's maybe not the most important thing to think about when picking a plan, but it's one of the bigger things because it's a definite for sure expense. So, and it's something that's probably changed, but when we talk about the 7.7 average enrollee increase, it doesn't necessarily mean that all plans increased at that amount. In fact, some plans last year, the premiums actually went down. There's a plan in Texas where the premium went down 50%. It's Baylor, Scott, and White. That's going to save a self-only enrollee about $1,300 next year. Some plans didn't change their premium. There's only about 8 of those. But then all the other plans increased. Some increased up to about 20%. So Make sure you're paying attention to how your premium changed. Best place to go for that is the last page of the FEHB plan brochure. That's the premium table. It shows you what you'll pay. Find the enrollee share, then find your enrollment type, either self plus one, or self and family, and then you'll see what your pay period premium will be next year.
Interesting, we're in an inflationary period, and you don't know whether general inflation is driving up healthcare costs or healthcare costs are driving up inflation. I think there's a little bit of both going on, perhaps. And you raise a point that actually came up in a conversation I had the other day with 2 long-term married feds, and they were debating whether to go with individual plans, just each one buy their own plan, they were different agencies, or stick with the me plus one. And how do you think about that one?
Well, it's actually a cost-saving strategy. If you have 2 federal employees that are married, you actually are entitled to have your own plan as a self-only enrollment. And oftentimes that's a way to actually save some money. And it may be that one plan might work better for one spouse and another plan works better for another spouse. But keep in mind that if you do make that decision, there'll be an individual deductible that each person then will have to face versus both people together in a plan. So it is something that to look at, and you possibly could save some money doing that. So yeah, I think that's a perfectly reasonable strategy.
Yeah, if someone may have more health issues, they might need a more expensive, comprehensive plan. If the other person, the other spouse, is maybe willing to take the risk that they're in pretty good shape and there's nothing on the horizon, they could get a lesser plan and net would be a savings for the couple or the family.
Yeah, especially if that lesser plan is a high deductible health plan, Tom, which has a health savings account where the plan is putting a portion of the premium into that health savings account. And if you're able to put in a little additional money on your own, this is a really important way for federal employees to save money for healthcare expenses now and in the future. And what a lot of people don't know about health savings accounts and the high deductible health plans is once you turn 65, you can now use those funds in an HSA for non-qualified healthcare expenses. You have to pay normal taxes if you do decide to do that, but basically it turns into an IRA at that point, where you can use it any way that you want. So it's really should be thought of as something that can help pay for healthcare expenses I face now, in the short term and in the long term. We're all probably going to have higher healthcare costs when we age. Once we turn 65, most of us will take Medicare Part D, and that's an extra premium. And you can use your health savings account for any of those things along the way. Or if you want to treat your family to an awesome trip to Hawaii, you could use your HSA funds for that and just pay your normal taxes.
Wow. And just to clarify then, the high deductible can be offset by the HSA?
Yeah. So before you meet the deductible, you'll pay what's called the full allowed charge for any healthcare service. But the plan is going to fund a portion of your premium into the HSA. How much they contribute differs based upon the plan, but for self-only enrollment, somewhere between $900 and $1,200. That comes in every month. You don't get all of it at the very beginning of the year. So if you're unlucky and something happens to you in January, you may have some high out-of-pocket costs in one of these plans. But if you don't, then you're getting that $100 or so every month into that HSA. You can also then decide to make voluntary contributions if your situation or budget allows for it. Any money that you put in goes in tax-free. You can choose to invest it any way that you see fit. The HSA is generally managed by a financial service company where you have a range of investment choices. It grows tax-free, so any investment returns you receive, you keep tax-free. And it grows tax-free, and then anytime you want to take out money, it comes out tax-free for qualified healthcare expenses. Once you turn 65, then if you decide, you could use it for a non-healthcare expense and just have to pay regular taxes.
And those tax-free or allowed expenses are not necessarily just services, like if you need glasses or hearing aids or that type of thing, hardware also comes under that.
It's a brilliant way to use the HSA. Dental care, vision, hearing aids, you name it. I mean, it's a full range of qualified healthcare expenses that you can pay using a health savings account.
Okay, and what does, in the levels of HSA allowed this year, that's unchanged from the year prior?
No, it's going up. It's higher. So, the IRS announced earlier this year, I think it was around summertime or early summer, that the contribution limits are up in HSAs. They're going up $4,150 for one person, or for a family up to $8,300. So this is a great way to put away money right now. Understand you always have access to it if something unforeseen happens and you need to pay for an unexpected healthcare expense, or if you can keep that saved, keep it preserved, keep that planned contribution in, add a little bit on your own, have that grow. Maybe you have a great run and have 5 to 8 years where you don't have a lot of high out-of-pocket healthcare costs. We know many federal employees that have $25,000, $30,000, $40,000 in their health savings account because they've been doing it for a long time, been able to hit that max contribution, have seen some investment returns, and now have a quite sizable amount of money.
But you don't have to spend it all before the end of the period?
No, that's the great part of the HSA. There is no use or lose. So this is very different than the flexible spending account, which there's a use or lose principle with the flexible spending account that I think last year or this year, the limit was $3,050. And
I just signed up for my own this morning. That's why I know.
Yes, Tom. Well, that's actually a point I want to make with the federal government. Every federal employee should have a flexible spending account, okay? Everyone's going to be paying higher premiums next year unless you're in one of those plans where the premiums decrease. We need to find some ways to save some money. And the flexible spending account is really almost a frictionless way to guarantee that you'll save money, because you're going to have some out-of-pocket costs. You're going to go to the dentist, and you're going to have some out-of-pocket costs when you go to the dentist. Over-the-counter pharmacy items, allergy medications, an urgent care visit. You might get sick a couple times a year, have to go to the urgent care, or you have a sick visit with your primary care. There's going to be some level of out-of-pocket healthcare expenses that are somewhat predictable for you. And you have to have a little bit of budget discipline on this because you don't want to lose money. You don't have to be absolutely perfect. You can roll over, I think, $620 in any given FSA plan year to the next year if you don't use it all. But if you took the full $3,000 and you only used $1,000, you're going to be out some. So you do have to be careful. But only about 20% of all federal employees have an FSA. And it's only an option for you when you're an active federal employee. Once you retire, you no longer are eligible for the FSA. So I really am pushing. Please hear me when I say, if you're an active federal employee, get the flexible spending account. It's not entirely frictionless, right? The claims process, they may ask you for a receipt when you go to the dentist. But there's paperless claims now in the FSA program. So FSA Feds manages the federal FSA program, and they have paperless reimbursement. So a lot of times you're getting reimbursed automatically, from the provider. So it's a lot easier than what it was. I remember, like, when I had an FSA a few years ago, I would actually have to fax. You got to fax that receipt into this number, and it does not operate like that now. So it's much easier.
Probably more technology in that end of things than in the rest of medicine, or
Yeah.
so it would seem these days. Yeah, for me, I used mine up last year with these and a spiffy new pair of prescription Ray-Bans.
Oh, there we go,
I've
Tom.
been wanting for a long time.
Nice.
So a little Hollywood effect there from the FSA. Let's get back to the plans under the FEHBP. What is available this year? There's fewer plans, right, to choose from?
Yeah, much fewer, in fact. So last year there were 271. This year there's only 156. That's a big reduction. And there's one principal reason of that reduction. One entire insurance carrier left the FEHB program. So Humana, they had HMOs in various parts around the country. They had a big presence in the Midwest and in Florida, in Texas. And in those various geographies, for each major metro area, they would have a variation of a plan. So it led to a lot of different plan types under Humana. They have left. There's also some other smaller HMOs that have left. Indiana University Health Plan, AltCare, they had 2 plans in Ohio. So those plans have left. And if you were in one of those plans, you need to pick a new plan. Because if you don't, OPM will pick a plan for you. The plan they'll pick for you is the lowest cost national PPO plan, which is GEHA Elevate, which may be a good plan for you or not. But I think most people want to keep control over that decision of which health insurance they have. So that's something that you must do, is pick a new health insurance plan. One other thing that can change every year is the service area within a plan. So you might have a Kaiser plan that's available in Colorado that adds 2 new counties that weren't available last year, or that same Kaiser plan in Colorado may reduce the service area and take away 2 counties. So you do want to make sure that your health plan is still around in 2024, and you also want to consider if there's any other new plan options. There's only a few new plan options. Compass Rose added a standard plan next year, and then Centara Health, which previously had plans in the Newport News area of Virginia, they have added a new plan in Northern Virginia. So if you live in Northern Virginia, Centara Health has a plan that you've never seen before. And I always encourage, for one thing that you do is, even if you're not motivated to switch your health plan, you still have homework to do every open season. And one of those is, 1, is my plan still available next year? And 2, are there new plan options that I didn't have available to me last year?
Okay. And, an outfit like Kaiser, they have their own buildings where you go.
Yeah.
They look like hospitals. I don't think you can spend the night there, or maybe under rare circumstances. Does their coverage in counties only where they have a building, or can one of their physical sites, cover more than one county?
Yeah, they cover more than one county. So, DC, the Washington, D.C. area is a Kaiser market. There's a few Kaiser markets around the country, Atlanta, Denver, Washington, D.C., Hawaii, and then on the Pacific Northwest and into California. Fresno, San Francisco Bay Area, and Southern California. So they only have presence in those metro areas. And yeah, Kaiser is very specific that the providers, both the human resource providers and the facilities themselves, are all Kaiser branded. It's very different than many other, even local HMO plans.
Right, and has something new come in? You mentioned a couple. What's new there?
Yeah, well, it's only two actually, and one has been around, but a new plan option. So Compass Rose offers a standard plan, and then Centara Health has a new plan in Northern Virginia. So there's not a lot new if we're talking just about active federal employees, but there's a lot new if we start talking about retired federal employees. So I don't know, maybe we want to talk about new options for retirees now.
I think that's a good place to go right now.
Okay. So one of the most meaningful things that's happened for retirees next year is that Part D is going to be a very big part of your life, or it should be, and it will be even a bigger part of your life going forward. Now, federal annuitants haven't had to pay much attention to Part D in the past because prescription drug coverage from the FEHB plan as good or better than what you could get from a Medicare Part D plan. And you don't have to pay an extra premium like you would to go get, a Part D plan. But in 2022, there was the Inflation Reduction Act. And a lot of people maybe don't know that there was important Medicare Part D reforms in the Inflation Reduction Act. So a cap on out-of-pocket costs for insulin, no more than $35 a month. That's come into place now in 2023. Then next year, no more catastrophic coverage, cost share for any Medicare Part D enrollee that has prescription drug expenses over it'll be $8,000 next year. And then Part D premiums next year can't rise more than 6%. But the big one that's coming down the road is in 2025, $2,000 out-of-pocket limit for prescription drug costs out of any Part D plan. So if you have moderate to high prescription drug costs, this $2,000 cap is going to be really, really important for you. So this spring, OPM saw these reforms and challenged the plans to offer more Part D coverage to federal annuitants. And the plans have responded. Next year, there's 17 prescription drug plans that are being offered by FEHB plans. And in order for them to be approved by OPM, they had to offer as good or better prescription drug coverage. And we've looked at it, and it is true. It's as good or better. And then some plans have given the $2,000 out-of-pocket limit 1 year early. So all the Aetna plans, there's 3 Aetna plans that have it, including Aetna Aetna Direct Consumer Option, Blue Cross Standard, 3 MHBP plans, Foreign Service. They've given a $2,000 prescription drug out-of-pocket limit this year. There's no extra premium to get this prescription drug plan, and here's a kicker, you're going to be auto-enrolled. So if you're an annuitant with Medicare, either Part A or Parts A and B, you will be, if you're in one of those plans, and importantly, it includes the 3 Blue Cross plans, Blue Cross Standard, Blue Cross Basic, FEP Blue Focus. 2/3 of all federal employees and annuitants are in one of those 3 plans. So this is going to impact, quite a few federal annuitants. And overwhelmingly, this is a good thing. You're getting better prescription drug, benefits. And if you're in Blue Cross Standard, you're getting that $2,000 out-of-pocket limit. And so most people should keep this. But if you don't want to keep it, you can contact the plan and say, take me out of this Part D plan. Now, why would someone want to do that? Well, there's one reason someone might consider that, and that is if they're a high-income annuitant, defined by CMS as either an individual with $103,000 or more adjusted gross income, or a couple with $206,000 or more adjusted gross income. You will have to pay what's called IRMA, which is an income-related monthly adjustment amount. You like that acronym? That's a mouthful. but it's only $13. It's only $13 a month for Part D. Part B IRMA, which is also in place if you're high income, is close to $70. So it's a lot less, and what's probably true is that the value of those increased prescription drug benefits are going to be worth more than that Part D IRMA. So really almost everyone should keep this. Your plan's going to send you a written notification. If you haven't received it yet, expect it in the next couple of weeks if you're in one of those plans. They're going to give you 30 days to opt out if you want. If not, you're going to be enrolled in this prescription drug plan and you'll get a new insurance card with your prescription drug plan on it.
Yeah, $13 a month, that's 2 latte ventis or something. It's really not a big amount of money. My question is, maybe this is a philosophical question, but and I'll make an analogy, there's a theory that rent control reduces the amount of apartments available in cities. That's one theory. All this squeezing of drug prices while increasing availability and demand, that's got to come out somewhere else.
Yeah, well, I think good for FEHB, good for federal annuitants, maybe not so good for U.S. taxpayers because someone will be paying for this. But these programs are available to federal annuitants. They are real options for you. There are real options for you to save a considerable amount of money next year. And I think this is a huge win for federal annuitants. This is a benefit expansion.
My studio guest today is Kevin Moss, the editor of Consumers Checkbook Guide to Health Plans for Federal Employees. And continuing on that idea for annuitants right now, the retirees, of which we have very many in our audience, Medicare Advantage is something we should talk about too, in addition to the drug coverage.
Yeah, so the cool part about Medicare Advantage plans, they also package in Part D coverage. So the way, Medicare Advantage, sometimes called Medicare Part C, packages original Medicare along with Part D all into one nice little package for you. These plans have been around in the FEHB program for a few years. Next year, we're actually seeing 2 new national plan options for you. So GEHA in their standard and high plans have a Medicare Advantage plan. So everyone in the country will have those plans to choose from. The way these work is they're going to give you a portion of the Part B premium back as a Part B premium reduction. It varies based on the plan. Aetna Advantage, for example, will give you $100 a month per person on Part B back to you. The United plans, available in about half the country, give you $150 back. And there's actually some Kaiser plans on the West Coast that will give you $250. Now that's actually even above the standard Part B premium. And what they're really looking at are for any annuitants that are subject to IRMA, to help with that, or it's possible that you might be subject to a late enrollment penalty for Part B. So you get this Part B premium reduction, which is a very big deal because it's a for sure expense.
Right.
And then many of them, but not all, but many of them will zero out all out-of-pocket healthcare costs. So when you go to the doctor, when you go to the hospital, when you go to the urgent care, when you go to the chiropractor, acupuncture, you name it, everything mostly is zero in these plans except for prescription drug coverage. You're still paying for prescription drug coverage, you're still paying those copays, for your 30-day prescription. Aetna Advantage actually, as well as their prescription drug plan offerings, they have also added $2,000 catastrophic drug out-of-pocket protection. So you'll pay no more than $2,000 in Aetna Advantage next year. The combination of you getting some Part B premium back and zero out-of-pocket except for prescription drugs makes this the lowest cost health plan option really for almost all federal annuitants, especially if you're paying just the standard Part B premium. These plan benefits are so good, you have to consider this. We ran the numbers for the 2024 Guide to Health Plans. You can save $8,000 a year switching from Blue Cross Standard to a United Choice Retiree Advantage plan next year. That's a lot of money. And even if you were happy with Blue Cross Standard or Blue Cross Basic, that choice is so dramatic in terms of the cost savings that you have to at least go and consider this. Now, there might be some reasons why Medicare Advantage aren't the right plans for you. So if you are subject to IRMA and you have to pay higher Part B premiums, especially if you're above the first tier, the financial value of these are going to erode because you're paying that higher Part B premium.
Right.
So this may not be a good choice for you. You have to have both parts of Medicare, A and B. So if you were late,
everybody has A though, right?
well, yeah, most people do because most people are paying for it through their payroll taxes, while they're working, and you have enough work credits, you get Medicare Part A for free in retirement. But Part B is always a choice. Some people don't make that choice right away, and 5 years or 10 years down the road, want to go back and then realize, oh, I'm going to have to pay a 10% penalty for every year I didn't have Part B, and they may not have Part B. If you don't have Part B, then you can't enroll in Medicare Advantage. And that one last thing on Medicare Advantage, make sure you're taking a look at providers. You can go to any provider that does two things. They accept Medicare, but they also must accept the plan. So before enrolling in one of these plans, make sure that you are going to the carrier website, look at their online provider directory, make sure that providers you currently see, or maybe even future providers, if having access to Mayo Clinic would be important to you at some point in the future, go see whether those plans offer those provider networks.
Interesting. So if you are still working, but you are contemplating retirement within the next 18 months, 2 years, or whatever the case might be, what should you do to make sure that you're not out of line for what you would want from Part B?
Yeah, well, if you're still working, no problem. Because even if you work past 65, you will qualify for a special enrollment window. And while you're still working, there really isn't a reason for you to take Medicare because your FEHB plan is still going to be primary.
Right.
So why pay for something, with Medicare Part B if you're not really getting anything for it? So once you retire, though, you're still going to get that 6-month window to go enroll in Part B.
So you have 6 months from your retirement date.
Yeah, you do. And so you'll still have plenty of time to make this decision. And the case for enrolling in Part B has never been stronger, especially with these FEHB Medicare Advantage choices.
By the way, is this all much better than it is in the private sector?
Yes. And I'll tell you why. It's less complex. When we look at the private sector, there's this other, so you still have original Medicare, you still have Medicare Advantage, but then you have Medigap. And it's a choice of whether you go into Medigap or you go into Medicare Advantage. So there's this other layer of choice. And then I don't know if you've ever looked at Medigap, but they have different plans based on letters in the alphabet that all do things that are slightly different. It is hugely complex in the private sector. I think it's far more, it's even for federal annuitants, it's complex, and it's more complex than when you were an active employee because you've now got this separate insurance system that in many ways duplicates some of what FEHB is doing. And what your challenge really as a federal annuitant is, how do I optimize my choices here? How do I get the most out of this, basically, and with the lowest cost, but make sure that I'm still getting all the coverage that I need that's important?
So if you're a contractor and you're on the train of life, mind the Medigap, you might say. All right, we'll leave that one there. And going back to the plans for the land of the living, the people still working that have to make these choices starting today, well, there's some benefits changes too among that 156 left plans that people can choose from. And by the way, in a given spot, you don't have access to all 156.
No, you don't. That's correct. So I think in the DC area last year, I haven't looked this year, it may be a little higher. There were 38 plans with open enrollment, but DC has more plans than what you were going to find in Wyoming, where I'm from. So, but yeah, some big benefit changes have happened. But one piece of advice, really, even if you don't think you want to switch your health plan, don't assume that your health plan is exactly the same. We already know the premium's probably different. There's some benefits that probably have changed. And the best place to go to Section 2 of your official plan brochure, get the new 2024 plan brochure, either from your carrier or the OPM website or the Consumers Checkbook website. Go to Section 2. It will be what is new in my health plan for the upcoming plan year. They will tell you what has changed, and the plans do really a great job of highlighting those changes. So a few things that we picked out that we find interesting, just examples of what might happen in a plan. United Choice Plus Advanced. They're changing their catastrophic limit. They're doubling it. It's going from $3,000 to $6,000 for self only, $6,000 to $12,000 self plus one, self and family. That's a really big change. You have a lot more risk in that plan in 2024 than what you did in 2023 if you have that worst cost year. That may change your calculus as whether that plan is still the right plan for you. Now, this was an outlier. Not all plans did that, but I just offer that as an example of the types of things that you can find. You may find that there are different pre-authorization requirements for a procedure, either a plan adding new pre-authorization standards or actually taking them away, making it kind of easier to get that care that you need. OPM wanted to see plans do a better job with maternity benefits. Next year, SABA plans are offering doula coverage. So they're giving you, I think it's up to maybe $1,000 for a doula as a new benefit that they've never offered before.
Doula means?
Doula is, I think, a birthing assistant, basically, that helps you through the birthing process. So this is something that has, that at least SABA has never provided before and is rather unique in the FEHB program. One other benefit that was interesting, Blue Cross plans added marital and family counseling as a new sort of mental health benefit. So sort of a broader definition of what mental health is. And that was a new benefit that we saw for the upcoming plan year in 2024.
Wow, so you really have to read the fine print. You have to go to that section too.
Yeah.
And I mean, is it wise to try to look at all 38, or is there a way to winnow that down if you're in an area? I imagine New York, Los Angeles have large numbers of plans also. How do you begin the winnowing just to get to the 12 or 6 you might really want to consider?
Well, our plan comparison tool helps. Checkbook's Guide to Health Plans, we rank the plans on estimated yearly cost, all right? So that's the combination of for sure expense premium plus your likely out of pocket based on the information you provide to us that we know influences healthcare spending. We then run that healthcare estimate across all the health plans, and we're able to benchmark the plans, show you which plans offer the best value, and then also show you the plans that aren't offering the best value. And really what that is the winnowing process of saying, hey, these 6 plans are the lowest cost health plans for me. I'm going to dig in a little deeper on these 4 or 5 or 6, but I'm going to throw out the other 32 because they might be too expensive for me, and there's some better deals that are available.
I can see some difficult dining room conversations. Honey, I think we need to add the marital counseling coverage next year. And the other spouse says, why? That could be something difficult. But also there's a psychology here. I mean, does one's sense of risk tolerance and confidence that you can cover what might come your way, even if it's not insured, that figures into it too. There's not a total calculator here.
Yeah,
right?
I mean, you never know. No one can predict what's going to happen to them in the future. No,
Right.
We don't know if there's a new accident, there's a new disease that that we're going to have to deal with. I will say, generally, all the FEHB plans have good catastrophic coverage. I mean, there are standards that apply to all the FEHB plans. There's no so-called junk plans in the FEHB program. OPM has structured this system for you never really to be in a situation where you would find yourself, having something not being covered and have an insurmountable amount of medical debt. That's really not going to happen in the FEHB program, but there are certain plans, the way that they're structured, there might be a little bit more risk with them. And there's trade-offs. You could be in a national PPO plan that had high premiums and a hospitalization may only be $200. But you're paying those high premiums, which are for sure expense. You could get in a high deductible health plan that had much lower premiums. But if you had that hospitalization, you may have to pay that full deductible. So there's always trade-offs out there. Whatever your risk tolerance is, that you may prefer one plan over the other.
Yeah, it's good to point out you're not buying health care, you're buying health care insurance.
That's correct.
Two different things. And by the way, fertility coverage is something that is burgeoning in these plans. too.
Yeah.
Tell us about that.
Well, this was a benefit that generally the FEHB plans did not do a good job of covering historically. OPM earlier this year mandated that all FEHB plans had to cover both fertility drugs associated with IVF, and they had to cover artificial insemination procedures. These were, and this is a new benefit for any plan that didn't have that last year. This is going to be a new benefit that's available in all FEHB plans in 2024. That being said, there's still a lot of out-of-pocket costs for infertility coverage because, I think OPM, when they announced this, the fertility drugs with IVF may only be like 1/3 of the total cost of the full IVF procedure. So there's still really high out-of-pocket costs. When OPM announced this, they also said, and we would like to see FEHB plans do even more. We won't mandate that they do more, but we would like to see them do more. And not many plans did, but one that did, Blue Cross Standard, next year has $25,000 available for assisted reproductive technologies. The artificial insemination procedures and the IVF drugs do not count to that $25,000. So this is a huge improvement for Blue Cross Standard in terms of what they're going to cover. But still keep in mind that just because that's there, there will only cover up to $25,000. You're still going to have to pay the cost share. It's typically a co-insurance. It could range anywhere from 20 to 50% for these infertility services. And then some of the FEHB plans that are adding in the fertility drugs and the artificial insemination procedures, they're not counting those expenditures towards the out-of-pocket max. So they have excluded them from the out-of-pocket max. So yes, quote unquote, they're covering them. And but understand what that coverage is. You're basically getting a discount on those services versus having to pay the full thing out of pocket. But what you pay out of pocket for those may not count to the out of pocket maximum.
And this coverage is inherent to those plans. It's not some kind of a rider add-on type of thing.
Nope, it's inherent into those plans. That's correct.
Yeah, because the question is for those not of childbearing age or beyond the age when they would want to try to have a child in that manner. In a sense, they're still paying for that coverage.
Yes.
And is the relationship, are these more expensive, these plans that have the fertility coverage? Or?
Well, this is new territory because this is a big expansion of benefits that previously weren't available. So we don't necessarily know the impact of this, but there are some plans that have been operating for years with IVF coverage based on state law. So Hawaii passed laws quite a while ago that plans that operate in that state, that are based in that state, must provide IVF. So in the FEHB, HMSA and Kaiser, both in Hawaii, have to provide IVF. That's even better than the Blue Cross benefit because you're paying 20% cost share with no ceiling. So they're not saying up to $25,000. They're saying, we'll pay whatever it is, but you'll have to pay 20% of that.
Well, I'm sure there's a million federal employees that would like to have you over for an evening to go over this with them, but they can't do that, so they're listening to what we're saying today. And take notes, folks. But my question is, just briefly, I think it would be interesting for people to understand how you come up with all of this comprehensive coverage with the checkbooks.
Yeah, well,
there's no shortcuts, are there?
There's no shortcuts here. There is plan data available from OPM, but a lot of the plan data isn't exactly what we need because in some ways it doesn't tell you if a benefit is subject to the deductible or not. Well, Tom, here's what we do. We look at brochures. We look through all 156 of these plan brochures. I reach out to carriers asking them for their Medicare Advantage plans. I'll go out to carrier websites and download materials. And we put this data into our systems and we run our actuarial models. So it's a lot of shoe leather. It's a lot of hard work for us to do this, but it's really important and we think it's really unique what we provide.
All right, and we should also probably take a moment to talk about how few federal employees actually change their plan every year and why that's not a great idea to be on autopilot with your health care coverage.
Yeah, it's far too few. It's about 5%, Tom, who will change their health plan in any given year, and it's far too low. There's a lot of sometimes inertia in the plan that you have, and unless you have an adverse experience, most federal employees will just keep the plan that they have. But the danger in doing that, especially on the annuitant side, is there's a lot of innovation that's happening, ways for you to save money that if you're not looking at it, you're missing out on better benefits. And it's quite possible that you're overpaying versus some less expensive options that could provide just as good, or in some cases maybe even better coverage for a lower price. So it's something that I preach all the time. You may be in the right health plan, but understand your health plan that you had this year is not your health plan next year. The price is going to be different. There's probably benefits that are different. It may no longer be the right plan for you. Every year there's new plan options. This year, not as many, but there still are some. And there could be other things that are happening where there might be certain plans that do a better job covering some particular need of healthcare that you might need. In this year, the big case then is fertility coverage. That Blue Cross Standard may be a great plan for you if that's a service that you need.
Interesting. All right. So make that choice. You're telling people, take the time, take that evening on the dining room table and really go through this stuff.
Yeah.
And once you are enrolled in open season, that's it. You can't change it for the year. So it's an important decision.
With one caveat. Qualifying life events, Tom. You could have a qualifying life event. The two big ones are getting married or having a baby. This allows you to change health plans outside of open season. But generally, open season is the only time that you can switch health plans. So take advantage of that.
What about the loss of a spouse?
Yep, that's another reason.
That's another one.
Yep.
And let me ask you this. What is the latest people should think about with children that are growing up? Because a few years ago, I think under the Affordable Care Act, the age at which you could cover children went up a lot. What's the current thinking?
Yeah, so FEHB has the same standards as the Affordable Care Act, so up to 26. So a child can be in your coverage up to age 26. And at that point, they have to go out into the marketplace. Hopefully they have a job. Hopefully they have their own employer-sponsored insurance at that point. That's what we all hope. That's what I hope for my children.
All right, Kevin, you are encyclopedic. Thanks so much for being with us.
Thanks, Tom. Thanks, Federal News Network.
And we've been talking with Kevin Moss, the editor of Consumers Checkbook Guide to Health Plans for Federal Employees. I'm Federal Drive host Tom Temin. You're watching Federal News Network. Let's go back to the studio now for more on the Open Season Exchange.